Um, Actually, I don't know much about public health, so I don't consider myself an expert to comment on whether the U.S. should increase um, investment in public health. But I think one of the difficulties that the U.S. faces is that the system in the U.S. is set up against uh, public health, basically. You know, all the medical systems is set up against greater investment in public health. People here just more take more pride in treating people instead of preventing disease. Although I have to qualify that is that the transition now to value-based care is changing, turning the tide a little bit. But so far we haven't really seen any promising evidence of this being a successful effort in the aggregate. So I'm not positive of whether
Yes.
success in public health is gonna happen in the U.S. anytime soon. But on the other hand, during the pandemic, actually, a lot of the U.S. system is being, even though you has a lot of, you can find a lot of faults with the U.S. system. But one thing it's great is that it's very flexible. So even though it has you can name many different limitations of the public health system in the U.S. is that during the pandemic, one thing it shows is that it's very flexible in mobilizing military forces to come in to shoulder much of the responsibilities that should have been done by public health professionals in many other countries. So I think the semi-militarized operation in the U.S. during the pandemic is one example of the government can mobilize resources from different branches of the government, many different agencies, and put them together and organize, for example, by FEMA to mobilize a very efficient force to deliver the care that's needed to wherever it needs the most. So I think one thing that you will find comfort in is that the flexibility of the U.S. system in addressing the limitations of its existing public health system.
I just one last thought. Public health, again, I use that analogy of a war, because public health is something that is not affecting one individual. It's not something private. It's something that actually have a population-based effects, which means that any individual decision may not be internalizing all the consequences. What Obama has set up is there's a commander-in-chief kind of system that would kick off during these crises, and that is completely missing in the U.S. this time to coordinate. And that's missing in the U.S.
Maybe he was fired by Trump.
It was taken away before the pandemic strike. Yes, unfortunately, and the money that was put aside that would be available whenever there's a pandemic was also repurposed.
Yeah.
Thank you for the great discussion. Since we're reaching 11 p.m., so we will let our discussion and also our presenters to rest.
Yes.
So and thank you so much for everyone's perspective for this great discussion. And I totally agree with your thoughts, and especially with Dr. Yin mentioned, money doesn't change public health. It needs a comprehensive system change to improve public health. We don't see it just in China, we also see it all over the world. And this also reflects Dr. Chen Xi's presentation that collaboration could help us to fight COVID-19. Again, I want to thank again for our presenters and discussant. You have been amazing, and also I also want to thank for the China Data Institute and the Future Data Lab, as well as China Health Policy and Management Society for sponsoring the webinar series. And many thanks to you, our listeners, for joining us today. I have seen that you posed lots of questions that we probably not able to answer all of them, but please do continue the conversation through our WeChat lab or through our WeChat group, or you can also please feel free to email us. Thank you so much. Our next webinar. Thank you. And so here is an advertisement. So our next webinar will take place in 1 week on July 30th from 9 p.m. and 11 p.m. Eastern time, exactly the same time. So we look forward to see everyone the next time. Thank you.
Thank you.
All right, thank you. Thanks, Mengxi, for your excellent coordination.
Thank you, Dr. Bao.
Thank you, everyone. Have a good evening. Have a good.
Thank you, everyone.
Bye-bye.
See you next week.
See you next week.